Lisa, there's a question from Mauricio. What platform are you using in Guatemala?
Okay, in Guatemala we will be using the Roche platform. I have to say first, in all four countries, the consideration of platform is not our decision. We work closely with MOH, and also with all the relevant national programs. Once again, TB, HIV programs. So in Guatemala, actually, the government requested us to work with COVAS platform.
Okay, there's a question from Maribel. Do you think it will be easier to integrate HPV testing and treatment in already established HIV care clinics versus other facilities, Lisa?
Thanks, Maribel. Well, integrating into HIV care clinics, I think that's a very natural integration, and this is what should have happened already for, for cervical cancer screening, and in many countries, cervical cancer screening is already part of the HIV protocol, but unfortunately not really reinforced in the field. So yes, we do think that that's a natural integration for HIV clinics. Whether it's going to be much easier than other facilities, we don't know yet. We will. This is what we will find out, I think, through the project, because we're really looking at very different setting of facilities.
Mauricio has one more question, Lisa. What is the estimated cost
Uh,
of HPV test?
Good question, but this is confidential for us right now because as this is a donor-funded project, so our unit cost was negotiated by the donor, and also CHAI. So I'm not sure I can communicate this right away.
But I can tell from overall, work beyond success project. This range from, I mean, the upper limit is anything, but it ranges from anything between $10 to $20 based on negotiations. Um, um, I'm not talking about success project at all here.
Of course, one of the goals of the project, like many UNITEP projects, market shaping and really to be able to bring down the price. So this is what we are hoping to happen towards the end of the project.
I also have a question to Lisa or Somesh with the current infrastructure being deployed for COVID testing. How does that interfere with this project? Because we expect more infrastructure will become available in the coming months or years.
That's a really good point, because we do see, for example, in the Philippines and in Burkina Faso, the country is procuring more testing platforms. But this can be another way around. So our JPICO team in the field is now working with the Ministry of Health to understand, how are this platform going to be deployed and what's the plan. So a good quantification exercise has to be done to understand what may be the availability of for HPV testing from now on. And one thing I think from the presentation from Partha earlier, in terms of COVID opportunities, we do see COVID in this instance as an opportunity, because it forces, in a way, many countries to think about integration. So this could be an opportunity that they will be able to explore further.
Thank you, Lisa and Julie, for extraordinary, work that you're doing in the four countries, and we are looking for this continued partnership collaboration. It's very groundbreaking work. I mean, my closing remarks is very simple, that integration or co-testing and integration takes efforts at all levels of the health system, as Lisa pointed out, right at from the service delivery to the advocacy level with financing and other system components covered. So it's an ecosystem approach that you have to take. I hand it over back to you, Alex, to close the session and maybe take us to our break.
Yeah, thank you very much, Somesh. I also want to thank the speakers and the whole audience for joining us. So indeed, it's time to take a break. You can make it breakfast, lunch, or dinner, depending where you are. on this globe. So, but we'll reconvene in 35 minutes. So this is 35 after the hour. Hope to see you soon. Hope to see you all then. Have a nice break.